Hi, Michael back from the long way home. Hope you're having a good day. It's nice and hot here in Australia. I'm glad we've got air conditioning, otherwise I wouldn't survive. I don't know how we survived when I was younger, but we did survive, but I don't know how. It's certainly very hot out there now. So, the L3, L4 lumbar laminectomy decompression surgery I had 2 weeks ago is going well. The pain now is less than when I went into hospital, which is fantastic. One fellow, Brian from Perth, wrote me an email and asked me how I damaged my back. And what happened there was I was, and this is the problem with policing injuries. The biggest problem with injuries that you get in the police is you don't have any time to warm up. So you don't have time to do some running, stretching, jogging or whatever before some event happens. It just happens. Like what were we doing? I was in a high patrol car with the sergeant. Sergeant was driving. After a while you get a bit used to what's going on around you. You pick up this sort of sixth sense, something like that. You certainly get a feeling for when things aren't right. It was late in the afternoon, patrolling around the back streets of this not so nice area. He went to pull this car over for breath testing, put the lights and sirens on, and the fellow started to take off. And I said to him, I think he's going to jump out the door and make a run for it, to the sergeant. And as soon as I said that, he just jumped out of the car and made a run for it. So it's so funny policing, because you can go from 0 to 100 as far as your adrenaline goes in half a second, and things just seem to happen like it's some sort of muscle memory or something. Like I'm out of the car before I know it. I'm over the first couple of fences before I know it. So he's skedaddled across the road, running flat out for his life. I didn't know, but he was wanted escapee, so that's why he's running. With the drug problem, unfortunately, terrible thing, drugs. I feel sorry for people that get caught up in that, but yeah, that's what he was caught up in. So he went over a couple of fences really quick. I caught up with him fairly quickly. Fences just go bang, bang, bang. Like I'm a big fella. I'm sort of 188 centimetres tall, 6'1"-ish. Weigh about 125 kilos, so I'm a pretty big fellow. I can get over these fences pretty quick. I always could. So it just happens. You're full of adrenaline. You hit the fence and you're over the other side. Hit the fence, you're over the other side. You got your eyes on the offender at all times, trying to work out what he's going to do next, and how dangerous is he, and who is this bloke that's running for his life? Should I be worried that he might have a gun or a knife? Certainly. Has he? I don't know. This is the things you're trying to learn along the way as you're going over these fences. And probably about the fourth fence I went over, I couldn't believe it when I went over and leaned it. There was a pile of roofing tiles stacked nice and neatly up along the fence. So when I've leaned it on the roofing tiles. They've slipped, and I've leaned it really hard on the inside of my right knee. Smack. Twisted my ankle, hurt my back. Looked up at the offender. He's got a knife out by now. He's not far away from me, so knife versus gun. I pulled my gun out, told him to drop the knife, and strangely enough he did. So not much problem with the fellow. Then when he realised he'd been caught, he played the game, handcuffed, and no further fighting. But I'd done some damage. I knew I'd done some damage because I fell so hard, especially on my inner leg and my back, inner knee, I should say, my back, all my weight on it. I knew it was trouble. So anyway, back to the station, hand him over to the custody team. He's charged. I did all my paperwork and computer work, which takes a fair while. And then as the adrenaline starts wearing off, a couple of hours later, my back starts screaming and my knee blew up like a balloon. So I got my knee packed in ice. I've got some Panadol. I'm sat there watching TV in the staff room doing my paperwork now to fill out for the injury reports for work cover and for the police department and for the HR people. So once the adrenaline is wore off, the pain has gone way up. So the sergeant said to me, look, I'll do all the paperwork, my side of the paperwork, I'll get it submitted tonight for you, make sure everything's fine. You go home. It's nearly the end of the shift by then anyway, so I went home, and when I got home, I wrapped my knee in ice, laying on my back ice, and and that problem that's where it all started from. I had had other back injuries before that, because policing is a very unique occupation. Like, one minute you're trying to break a car door open to get to someone who needs an airway, who needs to have their head put back at a serious car accident. The next minute you're kicking a door in because some bloke's got a knife against his fiance's neck or something like that. Or climbing in through a window because someone hasn't been seen for a few days, climbing under houses, climbing on trucks, climbing under trucks. It's just full on. And climbing down embankments, slipping down embankments, climbing, doing all these things. And they take their toll on you after a while, and things start to add up. That's how I... Thanks for the email. That's how I initially hurt my back and my knee, and I followed up over the years with X-rays, and as I said in my previous chapter, my knee was replaced by a very good orthopaedic surgeon here in Newcastle, in Australia, New South Wales. He did a stellar job on fixing my knee. It's so smooth, it glides beautifully, so it's just so nice. And now I've had my back fixed, and I can feel, at 2 weeks, I can feel it's getting better. And I'm starting to think to myself, hey, this could be the time when I'm not going to be in any pain. And that hasn't happened for the last 20 to 30 years, so it's quite incredible. Now, my neurosurgeon who operated on my back also had a look at my neck for me, and on an MRI scan I still have a problem down at C7 on my neck, C6, C7. I had a freminotomy at C345 about 3 or 4 years ago, but she says you need another freminotomy which releases some nerves once again that are trapped in my neck. But she said that's not a bad operation either, so if I can knock over this back operation, then get my neck operated on this year, well, then by Christmas maybe I'll be pain-free for a while. That'll be absolutely sensational. I won't know what it'll feel like, but it'll be amazing. So I decided I'd give you some tips on what to do if you've got a back injury, and certainly what I think you should do if you've had a back injury and it's causing you pain, and you've had it for more than, say, 6 months, you should seriously have a talk to your doctor, your GP, and ask him what he suggests as far as doing some more investigation into it. Because it sounds like it may be, like, I'm no doctor, but it sounds like if you've got a problem for more than 6 months, you've probably got some nerve problems, not just soft tissue injuries. As I said before, I spent a lot of time having massage, acupuncture, everything. If you can name a conservative treatment or a treatment that would try and buy you a bit of time, with backs and necks, I've pretty much had every treatment going. Bowen therapy was very good for my back. I found it very good. But I think, once again, in my opinion, I'm not a doctor at all. I'm just a victim. I'm a victim. I'm a patient, a good patient, injured patient. I think, if you've got a mechanical problem, the only way really moving forward is talking to your doctor about getting a referral for some sort of investigation, whether it be CT, MRI, plain scans to start with, I don't know, whatever they decide's the best for you. But certainly if you start down that road, then if they do find an issue, you can go and take it up with a specialist orthopaedic surgeon or a specialist neurosurgeon like I did. And they'll guide you. Like I've had surgeons before in the past tell me that with my neck that the risks were more than the rewards type thing, and not to have the type of operation that was suggested at the time. So it's not that they're going to start carving you up straight away. They're going to do the best they can for you. And a lot of times the specialist surgeons will recommend some sort of local nerve block, or maybe a cortisone injection with a local anaesthetic nerve block to see if that calms the nerves down that are damaged. Cortisone, I believe, is a fairly strong anti-inflammatory, and some people get good results out of that. I get good results out of nerve blocks in that they've always helped me to tell the doctor where the pain's coming from, because if I think it's coming from, say, L3 in my back, and then when they put an injection in and it doesn't make any difference, well, then we start to think what's going on. Probably a better example would be recently I've had a lot of trouble with my arms and shoulders, very painful. I play the guitar, my left arm has a lot of trouble holding on to the guitar tightly now and fretting the strings, play the chords, which is sad. But I have educated myself a fair bit along the way, and I knew that chances are this was the neck causing this problem. So I was referred for an MRI of my neck, which I've had a few over the years. And then they compared this new one that I had late last year to previous ones. And yes, there's a problem down at C6. So my surgeon said, would you like me to try, give you a referral to try some cortisone nerve blocks? I said, yeah, that'd be good. So I had the left side done under CT. They do it under the CT scanner, so they can make sure the injection goes exactly where they want it, right on the nerve they're trying to numb. The fellow I go to that does that, doctor, he's very pedantic. He's a lovely Asian fellow, and if he's not happy about the placement of the needle, he will just muck around. It doesn't matter how long it takes. Unless he's really happy in the placement, he's not going to inject it. So he gets it just in the right spot. And as soon as he started injecting the first time, I could tell straight away that he hit the nerve that was playing up, because I could feel the needle hit the nerve and feel the pain going down through my shoulders from my neck to my arm. They put the needle in through here. And as soon as he injected it, the pain went away just as quickly. Before I even got off the table, it was that quick. So that's fantastic. I thought, this is fantastic. That was the best result I've ever had out of a block injection. So that I reported back to my neurosurgeon a couple of weeks later that had worked really well, and asked her if she could have a look at the right side as well, because my right side was very painful at the time. And so I went back to the same fellow, and he placed the one in, and the same thing, I could feel when he hit the nerve coming in through here. I could feel the nerve when he touched it, and I could feel when he was starting to inject the cortisone at numbing it. And that right side, it's been good ever since. So I've had probably 4 months now with no problem with my right side. Whereas my left side, the local anaesthetic cortisone wore off fairly quickly, and then we repeated it again just before my operation. So I got it repeated about 3 weeks ago, and it's been pretty good for 3 weeks now. But for me, the main benefit of what I'm having done with these injections is they're very good for diagnostics, because for diagnosing where the problem's coming from, now I'm able to tell my neurosurgeon that the main problem is C6 left side. That is where 90% of my problems are coming from. This side, yeah, plays up, but 90% of problem, left side C6, C7. So we've had a discussion about her performing an operation on that as soon as I get better from my lumbar operation. And yeah, I'm looking forward to that and seeing if we can do something to get some long-term results as far as the pain goes. So it'd be lovely to be pain-free for a fair while. Now, if you have to go in for a lumbar laminectomy like I had, don't be scared of it. There's nothing to be scared of. I've had some big operations. My neck operation was a big operation. They did 3 levels about 4 years ago. Massive operation and massive pain coming out of the operation and in the recovery. Yeah, something I won't forget quickly, but you do forget it over time. But I remember how bad it was. With the lumbar L3, L4 decompression, I went into hospital, had the operation. That night I felt good, but of course you've still got the anaesthetic inside on board, and that's that the other. And they had drips in me, and they had some Panadol going in on a drip. They were really good at the hospital, fantastic. Overnight I had this old school nurse looking after me, a lady my age, and yeah, very funny lady to laugh at. She had some really good jokes and sayings, and yeah, very caring people, the nurses at the hospital, the doctors. My doctor came in the afternoon I had the operation to see how I was, and she was happy with that. And I asked if I could go home the next day, and she said if I felt I could cope at home, yeah, probably. So I'm pretty used to operations in hospitals, so I always make sure I get my iPad because I'm a night owl, and I get a private room so I don't bother someone else, other people. Get a private room, set up my iPad, make sure I've got all my chargers, all my leads, my battery packs, and jump it off the phone and watch Netflix and YouTube and watch movies all night long. And so unfortunately I have noticed that even the private hospitals don't have Foxtel and they don't have YouTube. So I take my own little setup in there and stay awake all night, and I enjoy watching movies and things. It's just what I do. I'm a night owl. I wake up at night for some reason. But yeah, so next day, 10 o'clock, nurse came round, they took all my drips off me. They'd been monitoring me through the night, monitoring my oxygen levels, monitoring my blood pressure, temperature, my wound. It had a drain in it. But the surgeon came around the next morning, had a look at my drain, had a look at my wound, said she was happy with it, and if I wanted to go home, I could go home at lunchtime that day. So yeah, I was able to cautiously get out of bed, do a bit of walking around. The physiotherapist came and saw me, told me a few things I've got to be aware of, and how to look after my wound, and gave me 3 or 4 exercises to do. Not many exercises, 3 or 4 nice easy exercises to do at home, which I'm doing. And I was allowed to go home. Now, this is an important bit. You need to have a friend or a family member pick you up from the hospital, in Australia anyway. I know this has happened to me every time that I've gone in for operations. They won't release you to a taxi or a hire car, or they wouldn't release me into a hire car or a taxi. It has to be a member of the family or a friend that they can hand you over to, and you can't get around the system because they're aware that people have got their cars there and probably going to sneak out and grab their car and go home, and it hasn't been 24 hours since the anaesthetic, and that sort of thing is not a good thing. So my wife came and picked me up from hospital, drove me home. I jumped into bed at home, put a couple of pillows underneath my calf muscles, laid down and watched TV in the bedroom. They gave me some fairly strong medication to take for the first week. which I did. I used that. I had a bit of a blow up halfway through the week, and I had to contact through the hospital my neurosurgeon on the weekend, but she rang me pretty much straight back and told me what to do, put the ice on it, and take some strong anti-inflammatories, some Nurofen that I had. So I took those and settled down overnight, and then every day since then it's got it better and better. People ask me, did I need a special chair, a special shower chair, special toilet chair, special bed? I believe some people do. I believe some people do need to have a commode over the toilet so they don't have to put pressure on their back to lift themselves off the toilet. As far as bed goes, the physiotherapists teach you this rolling technique where you can roll and use your legs as counterweights to pick you up rather than using your back muscles. You can't twist and bend your back. You've got to be very careful of that. And I didn't use a walking frame or walking stick, although some people might need to do that. And if you need to do that, that's what you do. Like, it's no problem. Just use a walking frame around the house for a while. Use a cane for a while. Shower chair, some people need them, some people like them. I just get in the shower. I've been lucky, I think. But yeah, I think everyone's individual, and everyone's injuries are different, and probably some people take longer to heal than others, longer to get out of bed and get around than others. But I've managed to get in my car a couple of days ago and go up to see a friend of mine a few kilometres up the road, stay at his place for an hour and a half, have a chat and get back home again. I do feel a lot more tired than I ever have, so I've been resting a lot more. That's just something you've got to do, I think. And as long as you do that, look after yourself, things go pretty well. So my suggestion is, though, a big suggestion, if you've got back pain, you've had it for more than 6 months and it's causing you to get grumpy, it's affecting your life, seek someone out that's going to help you. Seek a medical person out that's going to help you, a doctor, GP, family GP, something like that, someone who's been recommended to you, and go and discuss your case with them and just ask them what are my options, sort of thing. Is this something that I should be discussing with a specialist, an orthopaedic surgeon or a neurosurgeon? Is this something that I need scans or x-rays for? If it is, go and get them. We're lucky in Australia, like we have, if you go to the hospital with your x-rays or MRIs, you can book in and they will bulk bill you 90% of the time under the Medicare scheme we have here in Australia. So it's not going to cost you an arm and a leg, but certainly do yourself a favour and get onto it, because sadly it's not going to go away. If you've had it for over 6 months and it's a mechanical problem, I don't think it's going to go away. I was silly doing what I did, putting it off, crazy. And I've got a couple of friends of mine now that are doing exactly the same as I did, which sort of I can understand in a way because I've been there, but I'm trying to convince them that they must get in and get it fixed, because you get it fixed and then it's fixed and you're back on with life again. So that's my little story for today, and I hope you enjoyed it, and thanks for watching. If you like and subscribe. If you'd like to leave a note for me, please do. If you'd like to send me an email about anything that I've done before, during or after policing, anything about policing, recruiting, the police academy, my life after policing, what type of jobs I did when I was in the police. It changed me. It changes your life. I know, it changed me and I know when it changed me as well. But that's for another episode. So thanks a lot for watching.